So I'm going to demonstrate how to do a paediatric assessment. So the first thing that I would do is consider my scene safety, and then if appropriate I would do an ethane report. So for example, exact location is 20 Queen Street, Port Macquarie. Type of incident, we've been called to a 4-year-old male patient with difficulty breathing. No hazards, access is just through the front door, number of patients is 1, and emergency services required is no further emergency services required at this stage. I've utilised appropriate standard precautions, and then I would introduce myself to the patient and his parents or carer. So for example, I would walk in and I would say, "Good evening, I'm Emily from the ambulance service. How are you going?" And then I would ask for the patient's name and try to build a quick rapport with the patient and their parents or carers. I would then gain a general impression of the patient. So for this patient, they might be pale, they might have some obvious difficulty in breathing, whether that's increased accessory muscle use. From a distance, I might be able to hear some audible wheezing, and then I would also assess the patient's responsiveness, so in this case, their alert. I would assess for any obvious life threats, such as major bleeding, and whether I need to implement C-spine precautions, and I would also plan for 360-degree access for my kids. Then I would do the paediatric assessment triangle, or the PAT. So the first part of that is assessing the patient's airway and appearance. So I'd be looking at their tone, whether they're normal, flaccid or floppy, or limp. And then also their interactiveness, so whether the patient is able to interact appropriately with myself and their parents. Consolability, so if the patient is crying, for example, whether the parents or myself are able to console that child, or whether they're just really distressed that they're not able to be consoled. Look or gaze, so as I walk into the room from a distance, I would see if that child is able to notice my presence in the room and whether they're able to maintain eye contact with myself or their parents. And the S for that mnemonic stands for speech. So whether the child is babbling or cooing, or for a 4-year-old talking in sentences normally like they usually would. The next part of the PAT is assessing their work of breathing. So I'd be listening for abnormal breathing sounds, abnormal positioning such as the tripod position, any chest wall recession or accessory muscle use, and then also with the nose, just seeing whether there's any nasal flaring. The last part of the PAT is the circulation of the skin. So without touching the patient, I want to just try to ascertain whether they are perfusing well enough, and also whether there's any decreased cerebral perfusion, which might be evidenced by irritation, or irritability or agitation, or a decreased level of consciousness, etc. So following the PAT, I would determine if my patient is critical, and in this case we'll just say that they're not critical. I'd then move on to airway, so I could open the airway, suction or insert an airway as required. Breathing, I'd assess the rate, rhythm and effort, so whether they're tachypneic or bradypneic, whether there's increased effort of breathing, and then I'd also auscultate the 4 lung fields. And then I'd be looking at circulation, so I'd assess their pulse for rate, rhythm and quality, so whether they're tachycardic or bradycardic, whether it's regular or irregular, and whether the pulse is strong or weak. I'd also, for circulation, look at their skin color, their temperature, the condition, so whether their skin is dry or whether they're really diaphoretic, and also their capillary refill, making sure that that's less than 2 seconds. I then move on to disability, so I determine AVPU, so they were alert, and their GCS 15. I'd also do a pupil assessment, so I'd say I'm just going to shine a light into your eyes and then make sure that their pupils are equal and reactive to light. I then try to expose the patient while also trying to maintain their modesty, just so that I can gather a better idea of whether there's any rashes, or have a better look at their chest to see for any accessory muscle use, etc. Based on those initial assessment findings, I would figure out that my patient is stable at this stage. I'd obtain some vital signs, so blood pressure, heart rate, rest rate, SATs, blood sugar, temp, and if required an ECG, and then I'd try to gain a sample history.